Hi everyone, my name is Jackie Xu, and I'm here to present my Albert Schweitzer Fellowship end of year brief report. First and foremost, I want to extend a big thank you to Dr. Maureen Connolly, who has been my mentor at the KP School of Medicine, where I'm currently a third year student, as well as my mentor with my community partner, Dr. Ngozi Chukwu, uh, Interim Chief Medical Officer at Park Tree Community Health Center. She has been an unwavering source of support, and this would not be possible without the two of them. So I'm excited to talk a little bit more about my work for the past year alongside um, this amazing team. It's a volunteer program that we've dubbed Park Tree Community Navigators. A bit of additional context. Social determinants have been well established in the literature to determine 50%, if not more, of patient health outcomes. And increasingly, social needs screening and referrals are becoming an expectation in the healthcare setting. Here in California, we're monitoring the development of CalAIM, moving us in that direction. We set out to determine what is the infrastructure we need to start building at Park Tree in order to meet these regulatory requirements, but also for us to do the right thing for patients and build better capacity for social needs screening and referrals. What this looked like, number one, establishing that community network, because we know screening alone is not enough. We need to act on this information that patients are very graciously willing to share with us. That involved a lot of site visits, a lot of just Googling and looking at who was in the area, a lot of connecting with existing community coalitions around housing or transportation. Number two, how do we create the right data infrastructure so that we can keep social needs screening information housed within the electronic medical record, acknowledging that this is a key part of patients' healthcare? And three, how do we create the right legal infrastructure for student volunteers to be involved, knowing that we're handling a lot of sensitive information? So, putting all of that together, we have been able to conduct monthly on-site screenings for Park Tree's adult primary care patients. And these screenings have been coupled with pantry staple goods distributions that have been done in partnership with God's Pantry. God's Pantry has been very graciously supplying us with pantry goods that we're then able to bring on site and give patients before they leave the clinic. Because of Park Tree's location in the Pomona, Ontario area, most of the patients we work with are predominantly Spanish speaking. And in addition to this on-site work, we've established infrastructure to conduct follow-up calls for any patients who screen positive and receive information on site, in order for us to create that feedback loop and understand how can we better support patients. Is the information we're giving them helpful at all? So some initial data from our work so far, we've been running for about 7 months and have screened 80 patients to date. If you look on the right-hand side of the screen, we do ask all patients for their permission and for their interest in speaking with our team, earning more information about resources, again, acknowledging this is sensitive data. About 50% of them do want more information, whether it's phone numbers, whether it's various programs that we can refer them into. And on the bottom half of the slide, you'll see the primary social needs identified by our patients through screening, as well as secondary needs, acknowledging that many patients have multiple social needs they're working with. I'm very proud to say we're now established as an independent volunteer program at Park Tree. We have a leadership pipeline comprised of undergraduate students at Claremont colleges and have recruited other KP School of Medicine students into this work as well. Our follow-up calls are ongoing. Unfortunately, didn't have the space to share all that data here, But some initial stories of success just from my own interactions with patients. Um, there's been a number of patients who we had to call after they left the clinic in order to clarify a couple specific things on their screening, and who were actually already in line at some of the resources that we had referred them to for food and kind of grocery distribution. Um, in addition, we've been able to work with patients on helping them find different insurance enrollment resources, um, who otherwise were not aware that they could possibly qualify for something like Medicaid, and able to bring them into Parktree's enrollment team in that way. So sometimes all it takes is asking the right questions and getting to even make a small change to someone's experience through the healthcare system. So I've been really grateful to do this alongside an amazing team. Not everyone is pictured on this slide, um, but big shout out to our full group of student volunteers, and big shout out to our community partner again, God's Pantry, for supplying an amazing array of pantry staple goods. Thanks everyone for your time.